Hi, I'm Jessa, and today I'm going to be talking to you guys about HIV and AIDS in Kenya. So, starting off, I'm just going to go over some of the learning objectives that I will be going over in this video. So, we have the country overview. I'm just going to be explaining the background of Kenya a little more, jumping into what is HIV and what are the treatment options, and then political, social, and economic burdens in Kenya that affect HIV treatment and prevention. Um, So moving on to the overview, it's located in Eastern Africa. Their government, which is called the Republic of Kenya, consists of three branches. The executive, which has the most power. They decide who's in the cabinet, as well as the ability to ban any political party. There's judicial, which has the right to hear and decide on any case. And lastly, the legislative branch, which is in charge of creating laws and policies. Their head of government, as well as chief of state, is President William Ruto. Kenya is the largest economy in East Africa, and they are still a developing country. They have a population of roughly 54 million people as of 2022. You can see the age distribution in ratio to the whole population size in the graph displayed on the screen to the right. You can see that about 2% of the population is ages 65 or older, 59% is ages 15 to 64, and 37% is ages 0 to 14. Kenya, it has low public resources and a high public debt. They also have a risk of terrorist attacks in the north near Somalia. This terrorist group is a Somalian-based militant Islamist group called Al-Shabaab. These attacks often increase insecurity in this region. This worsens the socioeconomic situation, and it continues the growth of local conflicts and societal violence. They have a rapidly growing population, which leads to food insecurity. Um, Getting into HIV and AIDS, um, there's around 1.4 million people living with HIV or AIDS in Kenya as of 2022. There is a 3.7% adult prevalence. This shows that there's around 18,000 AIDS-related deaths. And looking at the brighter side, there are 78% of people who are on the antiretroviral treatment. The most common form of transmission is caused by sexual contact, and this infection is generalized there, meaning it affects all sections of the population, including children and young adults. The group that is most affected by HIV in Kenya is sex workers. They often experience violence towards them, including rape. Many receive post-rape medical care, but they don't speak up about their rapes because they fear they'll be detained for working in the sex industry. These frequent arrests often affect the treatment process for many as well. However, many of these women are good with condom use and HIV treatment since they're able to access them easier than most other groups. Homosexuality is illegal in Kenya, which makes it hard for men who have sex with men to seek out the HIV treatments that they need. The sentence can be anywhere up to 14 years in prison. The homosexual community is constantly harassed by government officials, which makes it um, fearful for them to seek out treatment. So, looking at the treatment options, they have needle and syringe programs as well as opioid substitution therapies. Um, these programs distribute clean injecting equipment, health services, as well as therapy. There's pre-exposure prophylaxis, which is also known as PrEP, which is the use of antiretroviral drugs to protect HIV negative people from HIV before potential exposure to the virus. There's also ART, which is antiretroviral treatment. It's used, however, most people stop taking their treatment as this leads to increased drug resistance. Looking at the chart on the right, you can see that they are effective. In the green, you can see people with um, new diagnoses, and you can see that they're significantly less than the previous HIV diagnoses. However, this could just be due to the stigma surrounded by it, or if people just don't want to go get tested. So who gets treatment? Anyone who tests positive after going to an HIV treatment center, they're immediately treated for the disease. However, the stigma that comes from having it, especially if you are homosexual, this causes extreme fear and ultimately causes a decline in people who seek out to be treated or tested. Common medications used, you can see on the right side of the screen, there's a box with a list of them. Those are the most common ones used. Um, so moving on to how these treatments are funded. So the main contributors are USAID, PEPFAR, Global Funds. They're mostly provided in Kenya from outside funding and donations. So I recently read an article that the Trump administration is going to cut into the USAID um, funding for this, and this would be an extreme decline in HIV prevention, seeing as there would not be enough supplies for everyone in need. So, issues regarding HIV prevention. Economically, poverty, especially with young girls with no financial independence from their spouse, this ultimately reduces their access to treatment. Politically, homosexuality is a criminal offense in Kenya, which in turn it frightens people into not getting treatment, and this goes along with social because people living with HIV often face a stigma and discrimination, causing them to not get tested or go for treatment. Lastly, how would my major help the HIV prevention in Kenya? So, I'm a marine biologist and environmental policies major, and while this might not directly correlate with the prevention of HIV in Kenya, there are also many ways in which a trained marine biologist could help. So, ways to help sharing data. Sharing data is always good in a scientific background. Um, Also, in many ways, a marine biologist can indirectly help the HIV prevention. An example of this being if a marine biologist helps promote sustainable fishing practices, it could potentially give someone an opportunity to use that for income instead of high risk jobs like sex work. These are my sources. Thank you.